When I arrived at Regional Health, we were just kicking off an Epic migration. So we were about 18 months out from the go live and the project plan was in place. And as I evaluated sort of what I thought would be the best way to get the most out of that implementation, I found out that we were still doing a large amount of back-end transcription. We rolled out Dragon Medical One about 6 months before our Epic go live. When we moved into the training phases for Epic, we integrated all of the training with Epic and Dragon so that providers knew when was the right time to use which tool. We needed an army of people to come in and provide the support with expertise and experience that we weren't going to have internally, and have at the elbow support for our go live with resources that were versed in both Epic as well as Dragon. So when we went live with Epic, everyone was well versed and prepared in how Dragon could work in the Epic environment, and really we had no pushback whatsoever.